Our work is focused on the molecular mechanisms by which the placenta develops, and this is important because it's defects in how the placenta develop that are associated with all the common complications of pregnancy, including preeclampsia, preterm birth and intrauterine growth restriction, which occur in 20% of first pregnancies. So we're developing diagnostic tests to predict which couples are at risk of pregnancy complications. This is important because pregnancy complications are very common and they can threaten the life of the mother and her baby. When women have a pregnancy complication, I'll give the example of preterm birth. It's highly costly to the community as well as, of course, to the family. There's huge emotional cost if you have a baby in a neonatal intensive care unit. But also the cost to the community is huge. It costs about $4,500 to $5,000 a day to keep a baby in intensive care. And if a baby is born, say, 3 months early, that's a huge cost to the healthcare system. So if we could predict which couples are at risk, and prevent that, or at least delay the occurrence of the complication, there's potential to save a huge amount of money to the healthcare system.
The expected outcomes of the research is to be able to come up with diagnostics and tools to predict which couples are at risk for developing these adverse pregnancy outcomes. This research can benefit the wider community because being able to target couples that are at risk for developing these adverse pregnancy outcomes, we can give them the tools and therapies they need to hopefully prevent these diseases and offer better health for the mother and the newborn baby.
A research foundation will both help researchers by improving our research outcomes, by facilitating collaboration and new innovative research, and also benefit the community because we can provide education and information for the public as to how to improve their reproductive health.